Democrat of California and vice chair of the India caucus in the House, and Dr. Ashish Jha, dean of the Brown University School of Public Health, who wrote a much-discussed op-ed for the Washington Post over the weekend, arguing that it is time for the United States, the world's oldest democracy, to come to the aid of this key global ally. Thank you both for joining me. Dr. Jha, let me start with you. You have been following the COVID crisis in America from the start. You're one of the country's experts on this. You've been following the pandemic globally as well. Put it in context for us. How bad is the situation in India right now with COVID-19?
Yeah, thanks for having me on. I would say it's pretty awful. We are right now in the worst days of the global pandemic in terms of number of infections happening globally, and India is at the heart of it. India is the epicenter. The 350,000 number that we're quoting is surely an underestimate by a lot. And so it's really quite a challenge, a situation we're in.
It's a huge challenge. And Congressman, you've been very vocally drawing attention to the situation in India over the past week and demanding the Biden administration do something. Does yesterday's promise of PPE equipment and oxygen and today's announcement about sharing 60 million doses of the AstraZeneca vaccine with the rest of the world, does that cut it? Is that enough for you?
Well, Mehdi, first let me say that my thoughts are with your family there, and you're absolutely right. There are many Indian Americans who have family there, who have loved ones there, who are in hospitals, some who don't have oxygen. So the situation is dire, not just from a statistic perspective, but also from an anecdotal perspective. And I just want to take a second to thank Dr. Jha. His advocacy, that op-ed, directly influenced the Biden administration's actions. I know this from talking to people in the administration and in Congress, and he really had a massive impact, and I really appreciate his leadership. I do applaud the president for the steps he's taken, getting oxygen to India, making sure that we're going to have AstraZeneca. I think it will get to India after they make sure that it's safe. And I appreciate things that Vinod Khosla and other entrepreneurs are doing, who've opened up Twitter direct messages saying, if you're a hospital and need help, direct message us and we'll get resources. But I think there's a structural problem, and that is that as the United States moves to full vaccination, over 100 countries around this world don't have access to the vaccine. We paid $2 billion for Pfizer to get those vaccines, to pre-order them. We gave Moderna the IP from the NIH. The least they can do is license their vaccine recipe to the rest of the world so the rest of the world can manufacture that vaccine. That's a moral obligation, and I believe the president should call the Pfizer CEO, call the Moderna CEO, and demand that. And if not, we will immediately remove the TRIPS waiver at the WHO.
So on that note, you just reminded me that I was planning to talk about this. You brought it up. Let me ask you, will President Biden at the WTO next month, you talked about the TRIPS waiver, this intellectual property agreement around the vaccines. India, ironically, along with South Africa, Congressman, came to the WTO 6 months ago saying, get rid of it. Let us make the vaccine en masse, generic versions of it. Will the Biden administration lead the way in the Western world and vote to get rid of that and allow that to happen?
They must. I mean, the argument is so simple. Pfizer will still get paid. Moderna will still get paid. What's happening right now is the rest of the world doesn't have the ability to manufacture the vaccine. All they're saying is, let us manufacture it. We're willing to pay you a licensing fee. We need to do two things. We need to allow the rest of the world to manufacture, and we need to have a global fund to assist with that manufacturing. There are 12 billion people who need vaccines, and we're a fraction of the way there. We won't get there if we don't have the mRNA vaccines licensed and capable of being manufactured other than by Pfizer or other than by a few select contractor manufacturers.
Well, I'm glad you are making that point and speaking out vocally. The pressure needs to be applied. Dr. Jha, let me ask you this from a health perspective. Are vaccines, as important as they are, going to help India right now, given the rate of infections, given how overrun hospitals are at the moment? What is the best way to help the Indian people tomorrow, Wednesday, Thursday? How quickly can we help them?
Yeah, so unfortunately, we have two sets of issues. We have about 4 to 6 weeks of, I think, infections almost baked in. So we've got to do what we can to help those people get through it. And that's the oxygen, the therapy, the hospital field beds, the shoring up doctors and nurses. That stuff is critical. What we want to do is make sure that this surge comes to an end as quickly as possible. For that, you need public health measures, more testing, more masks, and more vaccination. So I do think vaccinations are going to be very helpful once we get beyond the next few weeks. We've got to bring this incredibly horrible surge in India under control, and vaccines are one part of that. But you're absolutely right. In the next days, it's all about treating the people who are already infected. And that, of course, requires a Herculean effort to focus on the healthcare system.
And Dr. Jha, we're hearing a lot about the double mutant variant and about the various mutations and variants in India. How worried should we all be about them? Are they the kind of thing that could make our own Pfizer and Moderna vaccines eventually ineffective? Or is it that if we let the virus run rampant in a country of 1 billion people, at some point, inevitably, there will be a variant that our current vaccines can't stop?
Yes. So the double mutant, the much, kind of talked about double mutant, we don't know as much about it as we would like. We don't have a good sense of how widespread it is because that genomic testing is not yet being done. That needs to be done. I don't think that mutant itself is going to render our vaccines ineffective, but you're bringing up a really important point. Large outbreaks are really the fuel for more mutations. They're the fuel for more variants. And large outbreaks will eventually get us to variants that may very well push our vaccines' efficacy way down. I don't want to necessarily push our luck. Obviously, it's got a huge human toll, but it leaves all of us vulnerable. This is one of the many reasons we have to help countries like India and others bring those infection numbers way down.
Yeah. We do have to help them, but that requires public support. And thankfully, tragically, this story has now cut through in the American media, in the Western media, as we saw with the White House today. Congressman, let me ask you this, though. Three of us having this conversation, correct me if I'm wrong, we're all of Indian origin. We all have friends or family in India. We're Indian Americans. How do we get ordinary, average Americans who don't have any ties to India to take this situation, this crisis in India seriously and push the government to do more?
Well, first, I think we should be encouraged about a multiracial democracy. I mean, in some sense, the diaspora has had an impact, and I do believe it will make American foreign policy more empathetic. It has in this case, and it will not just with India, but nations around the world as more people have ties and understanding and exposure to other parts of the world. But I think there are two things that will get Americans to care. First is what Dr. Jha and you have said, that this is in our self-interest. You can't have the widespread, rampant disease outbreaks in other parts of the world and think that we are going to be immune. Even if they don't defeat our vaccines, they certainly will spread to parts of the population that aren't vaccinated. And so it's in our interest to mitigate that. And second, our conception as Americans, I believe that we do think of ourselves as a nation that wants to do good in the world. Yeah. It's our founding principle. And I think we have to appeal to that, and people will respond.
We can only hope. Dr. Jha, I need to ask you, how much of this situation in India is the fault of the government, the Modi government? It's arrogance, it's incompetence. It's been very Trumpian, hasn't it, in terms of super spreader rallies, the lack of masks, etc.
Yeah, look, I think most of us saw the infection numbers starting to rise about 2 months ago. And about a month ago, we were all raising the alarms that we were heading towards a catastrophe. The government really had this attitude of somehow India has beaten COVID when nobody else has. It is in many ways reminiscent of our former president. Again, he held large rallies with people packed together, no mask in sight. Those are just incredibly unwise things to be doing in the middle of a global pandemic. And unfortunately, the cost is being borne by the Indian people.
Yes, it has. Tragically, it has, and it continues to be. Dr. Ashish Jha, thanks so much for joining us on the show tonight. Appreciate your analysis tonight and that very important op-ed you wrote. Thank you so much. Congressman, stick around for a moment. I want to ask you about a little bit more about Indian politics and the Modi government, because you've been a critic of the Modi government. This is a government which not only mishandled the pandemic, but is in recent days asked Twitter, and I know you're the congressman for Silicon Valley, asked Twitter to take down tweets criticizing its handling of the pandemic. That's how authoritarian this government is. What do you make of our, not just our alliance with this government, but the idea that as much as America or the world or the WHO or the WTO can do, fundamentally, it's also a government problem, just as it was here over the last year.
Well, first, let me speak perhaps from a spiritual or a religious perspective as someone of Hindu faith. One thing the virus has taught us, is humility. This idea that any person or any nation would think that we've conquered a disease, I think runs contrary to what most religious teaching is about, which says have some humility in the face of these tasks. And so I think part of the response has been not sufficient humility. The second thing, I mean, the idea that you would censor or tell Mark Zuckerberg or Dorsey to take down tweets, I mean, I'd be at it all day. I think there are more tweets criticizing me than not. And I think that that's what makes our democracy so rich. It's a lot of times it makes me rethink something or rethink how I phrase something. Again, it gets to this point of humility. It is the essence, again, of Hinduism, as I understand it, is pluralism, is understanding different perspectives. Amartya Sen wrote a brilliant book, The Argumentative Indian. So it is contrary to that very spirit to try to squelch this debate.
Problem is most nationalist right-wing governments aren't known for their humility. There are a lot of authoritarian governments, allies, that the US just gives a pass to, whether it's Israel, where mobs have been chanting death to Arabs in recent days, Saudi Arabia, where MBS got off scot-free for killing Jamal Khashoggi, or India, where Modi has been dismantling democracy in many ways. How do you get Joe Biden and American foreign policy to change on that?
Well, I think right now the immediate need is how do we help India make sure that they can deal with COVID. But I think more long term, we need to make sure that our values are always at the forefront. So to speak about making sure that the internet isn't shut down, to speak and make sure that there is not censorship, to speak about religious pluralism and religious tolerance and how that is American ideals and also, in my view, India's ideals, and make that front and center of any conversation. I do believe, having talked to Jake Sullivan and in the past Secretary Blinken, that they will make those issues front and center. But right now, obviously, politics has nothing to do with getting oxygen and getting medical supplies to whoever we can in India.
Agreed, but I was just talking big picture. As you said, the long-term dealing with authoritarian allies is always a problem. It's easy to go after the Irans and North Koreas of this world. Just to clarify, Congressman, the last time you and I discussed Israel and Netanyahu, I want to clarify, you were criticized for suggesting Israel's burning villages or homes in the occupied West Bank. That was a slip, wasn't it? You weren't referring to the government.
I misspoke, and I acknowledge that. Israel has engaged in demolitions, which I criticized in a letter with Anna Ashu, but I was wrong to suggest that Israel had in any way burned villages and has not. And so I want to correct that for the record.
Even though, unfortunately, Israeli settlers have burned down orchards, and you have been, thankfully, an outspoken voice on human rights across the Middle East. One last quick question for you. California now has enough signatures to force a recall election of Governor Gavin Newsom. Will he be recalled and defeated, in your view?
No, he won't. In fact, I was speaking to him this morning. He also is helping, California is helping India, and we were talking about that. But I think this has energized people around Gavin Newsom. It's had Democrats put aside their differences. The polling I've seen suggests he's very popular. The party is unified around him, and it's going to be unsuccessful. And it's a shame that we're going to spend so much time on something that really doesn't have organic support.